see the right slides now. Okay. It's actually nice to be able to see people. The last time I did a Zoom presentation, I looked at a bunch of empty boxes with just names. So it's nice to see faces while talking in my office alone. So as Mary said, I'm Phil. I am a social worker here at WVU Medicine. The office I was working at closed back in October, and so now I'm working out a Healthy Mind still in the Cheat Lake area. So hopefully, even though we are not in the room together, we can still make this as interactive as possible. There'll be a couple spots where maybe we stop and ask some questions and do some brainstorming, and then there's also a short video where I'll ask you guys kind of what that experience was like for you to witness. So hopefully what you guys will get out of us talking today is just kind of increasing some of your knowledge and understanding of military culture, identifying some clinical challenges that might be unique to military service members and veterans, explaining the impact of substance use, and then responding to ethical challenges when working with service members. So first, kind of getting into just the culture and the role of the social worker. I'm not going to get a whole lot into kind of what the rank structure is like. We've talked about that in previous lunch and learns. But really kind of some of the challenges that are unique to civilian therapists is just what are the military acronyms that come up, things like DFAC or MOS, different things like that. What is rank and grade system, but also looking at beliefs and assumptions, spoken and unspoken within the military culture. So the thing that I really try and get folks to remember is that even though we might not know what the acronym is, it's okay to ask questions. So if we're working with a service member and they say that their MOS was 42 Romeo, unless you served, you probably don't know that that means that they were an instrumentalist in what that job detail actually entails. The other things we kind of want to think about as challenges is being aware of what is not being said and understanding the restricted nature of the military. The military has very unique boundaries, rules, regulations, and habits that might seem a little off-fitting for those who haven't lived that before. So now looking a little bit, why do people join? So it's not an exhaustive list, obviously, as why people join, but these are good 4 basics to consider. So family members who've lived their lives on military installations kind of become attuned to this lifestyle and the safety that it can present. And kind of reading and preparing for this presentation, there was a story about a young soldier who was anxious about the possibility of living in the civilian world. So she joined the Air Force. She found it was uncomfortable being at college in an insecure world with too many choices and too much freedom. So young people who grew up in the military often share that later they joined because it was more comfortable than the civilian world. An Air Force veteran also stated, I think it's important to note that many families have numerous members who have served our country proudly and have provided them with the emotional support to complete their tasks. Some other going on with benefits. So financial concerns almost always contribute to a decision to join the military. Service members may tend to come from places that lack other economic opportunities. Military is often also seen as an option for young people who don't have clear future plans. So when I was going through basic training, it was nothing for us to sit down and talk about why we did what we did. And a lot of us said because we didn't know what we wanted to do. The military has been called the great equalizer for many in our society. A high percentage of lower income youth have correctly seen the military as a road to upward mobility, education, respect, and prestige that they perceive would be impossible if they remained in the civilian world. So even joining things like the National Guard can afford folks to go to college that could no otherwise afford to go to college. Or now post 9/11 GI Bill, where it allows a friend of mine enlisted into the Navy for 4 years and now is attending medical school for free because he served for 4 years. Looking into the identification of the warrior mentality, many who join the military feel a need to merge their identity with that of the warrior. The structure, the expectations, rules, even the penalties and overriding identity as a warrior are reassuring, while at the same time providing service members with security, identity, and also a sense of purpose. A San Diego therapist noted that the profile of the service member who made the military a career during the time of the draft is often similar to those who now volunteer, as the military offers a reinforcement of a belief system and also a personal identity. Previous work on the topic of war has explored the psychology of war as a test of manhood and a rite of initiation among males in many cultures. So it's not uncommon for young men to merge their identity with that of a warrior by being part of something that's more meaningful. And finally, an escape. So the military also satisfies a need for some young people to escape from painful life experiences, a need for dependence, drawing them to the predictable, sheltered life that they did not have growing up. Last year, I think it was last year, I talked a little bit about military sexual trauma. And unfortunately, the escape is not always the escape that folks are looking for, especially whenever we're joining into the ranks and we're hoping to build a family, and then the family ends up harming us. Military service becomes the extended family that was not experienced growing up. Sometimes young married couples come into the military as an escape from their respective families, only to unconsciously run toward becoming a part of a third extended family. The author Wirch in 1991 points out joining the military in order to put oneself in the care of a good surrogate parent is hardly the sort of thing one is likely to advertise. In fact, it's a secret so deep-seated that those who act upon it guard the secret carefully. So just some considerations for those of us in the healthcare field. Being mindful of the virtues and ethics of the military, it's important for the helping professional to separate the service member from any underlying political agenda involving war or any missions that are operated. It's also important for the helping professional to recognize the service member's values to fight for peace, exercise restraint, and obey the chain of command. The clinician should also self-monitor instances of countertransference that may spark controversy and negatively impact the therapeutic relationship. In an effort to remain strengths-based, the clinician could acknowledge the virtues of the military and commend their willingness to serve at a personal sacrifice and for a purpose larger than the self. One thing that I ask everyone to remember is that we operate under a volunteer force. So a lot of these service members now have been fighting a very long war, in which many have served on multiple deployments. There was one instance where I was away at a training where one of the soldiers was on his 6th tour, and that was relatively early into the war. The way he saw it is that it was his mission to serve, as he didn't have any kids and his parents were already deceased. We'll get into a little bit more of that later. So the word motivation means to move. It's defined as the internal factor that induces behavior and gives a new direction to efforts. Motivation is integral to everyone's lives. Motivational theories describe the various processes that generate rationales about why and how that affect and induce behavior patterns that impel us to grow and change over time. So looking a little bit at Maslow's hierarchy of needs, we've all probably have seen this chart once or twice throughout our careers. But just kind of looking at it from a military standpoint for a minute. So the military offers an environment in which each of these needs can be met by the service member. The 5 levels of human need comprise the essential steps for developing the whole person. These levels are viewed as logical and sequential in nature, progressing from basic physiological needs and safety and security needs, beginning at birth and continuing through all stages of life, followed by the need to experience love and affection, meet self-esteem, and achieve self-actualization, or as the Army was so eloquently put years ago, be all that you can be. So in basic combat training for the Army, there are phases that soldiers work through. The first phase is viewed as if a single soldier makes a mistake, the entire unit makes a mistake. So then the entire unit is the one doing push-ups and basic calisthenics. This idea then brings that we are as strong as our weakest link. We then work as a team to build everyone up. And as we progress through the second phase, a transition begins to take place where we become a little more singled out if we make the mistakes. But what you tend to find through observation is that even though a single soldier might be getting punished, the whole unit will still rally around that soldier and help lift them up. And those can be observed through team building exercises as well. So if somebody's struggling to get over the wall, you don't watch them struggle, you figure out a way to help them over the wall. So some characteristics of military culture. Again, this is not an exhaustive list, but these are just some of the unique facets of military life. A lot of these were described over 3 decades ago and remain true for military families today. So just looking at a couple of these, frequent separations and reunions happened a whole lot more during OIF and OEF, where soldiers would deploy through 6 to 19 months, depending on their branch of service. And, being an Army musician, we performed just about every homecoming and deployment ceremony in the state. And they all had different things in common, but one thing they had that was very similar was Desert Storm vets and Vietnam vets welcomed them all home with waving American flags, because it's not necessarily what they got. And so, they tried to make the separations and the reunions as special as possible. Looking at regular household reactions and how, the roles within the family system changes over time. A friend of mine recently got back from Kuwait, and while he was overseas, his first child was born. And just reaching out and talking with him recently, they're still trying to figure out life. How does he fit in as a dad and as a husband? The other kind of unique military facet is the mission must come first. And that can be a hard thing, especially for new military couples to kind of wrap their head around, is why does the mission come first, even on Christmas morning? And what that might look like. Early retirements. If you enlisted at 18, you can retire from the military at 38, but you can also medically separate day one of service. So there's all kinds of kind of different caveats to military retirement. Unfortunately, just like in the healthcare field, there's always lots of rumors. And so making sure, all information is sent out correctly. So just like on the soldier side, there's the chain of command. On the family side, there's the family readiness groups that will also disseminate information to try and stop the rumors. And then you think about social effects. We'll get into a little bit of what socially the military looks like between enlisted and officer, and even how that impacts the family. And then there's also a sense of lack of control. Soldiers don't always get a pick when it's their time to deploy. They also don't get a pick if they, want to deploy, but they're assigned to a non-deployable unit. There are a lot of barriers to a decrease in control in the military culture that we don't necessarily feel here in the civilian side. Here's another quote from Mary Warch. The great paradox of the military is that its members, the self-appointed frontline guardians of our cherished American democratic values, do not live in democracy themselves. The only example I could really come up with this, thinking of a personal example, is we were tasked to play for President Bush. I don't remember what year that was because it's been a little too long ago. But one of the first things we had to sit down for was a briefing on how to respond to news outlets related to playing for the president when wearing the uniform. And so, we don't get to sit there and say we either support the president or we don't. The only thing we are really allowed to say is that we support our commander-in-chief. And so, we don't get to display that. And we've seen that a lot recently with the activation of the National Guard. The National Guard is activated under the direction of the governor, unless under special orders, and then the president can activate. But just because those soldiers are activated does not mean that they necessarily are there for the political reasons. They are there because it's their job to be there and to maintain safety. Getting into the class system a little bit more. Just nowhere in America is the dichotomy so omnipresent as on a military base. Nowhere do the classes live and work in such proximity. Nowhere is every social interaction so freighted with class significance. The thousands of people on a military base live together, have the same employer, dedicate their lives to the same purpose, yet they must not socialize outside of their class. And so imagine if that was our jobs where we could not socialize with our bosses. So if you look at, I don't want to get too much into the next slide here, but just kind of thinking about it for a second, if you look at the holiday season, if we weren't in the middle of a pandemic, a lot of us would probably have holiday parties coming up. Within those parties, oftentimes it might be your boss is there, or maybe your lead or whoever. But in the military, that's typically not allowed. You have your NCOs, you have your junior enlisted, and then you have your officers. And the fraternization within the military is something that's taken very seriously. So looking more into subcultures. So there are two main subcultures. You have the officer and the enlisted, but then you have those that kind of meet in the middle and there are non-commissioned officers. So there are E4s and up. E4 is split within the Army in two separate categories. You have specialist, which is junior enlisted, and you have corporal, which is a non-commissioned officer at that point. But the military is distant from civilian counterparts, and this creates distance within the military itself. The families are expected to maintain this discipline as well, officers' families versus enlisted families. The importance for social workers is that it is also an essential ingredient in a clinical setting. So doing an assessment and initial intake, RAKE can give us important information such as stressors, military history of the client family, length of service, and possibly certain duties and experiences that could impact an assessment, intervention, or care. Another consideration is that professional caregivers like social workers, counselors, etc. will more than likely be viewed by those in the military as civilian, officer equivalent, or an authority figure. Military social workers are officers. And so that's why even if we are not wearing the uniform, working with the military, they may feel more comfortable addressing sir and ma'am, even though it might make us feel, at least it makes me feel old. Practitioners may need to be aware that enlisted service members may respond differently than officers based on this common belief, possibly leading to initial difficulties in establishing rapport. The few officers that I've worked with, they've been much more open than just kind of coming in and having a conversation. The enlisted have always been a little bit more guarded when opening up in sessions. But also thinking about kind of assessments, we don't want to just get stuck on the military history. We want to look at them as the whole person. So even though they've served in the military, they might not be initially coming to us because of things that happened during military service. It could be just adjusting to civilian life. How do you wake up in the morning and pick what clothes you're going to wear when you didn't get an email before that you're supposed to report in Class Bs? And you actually have to pick out what your work clothes are going to look like. So all those small things that sometimes we take for granted can be very difficult when adjusting back to civilian life. Looking at importance of the mission, so the conditions and demands of a total commitment to the military is typically a commitment to one's unit, the unit's mission, and its members. It's the very essence of military unit cohesion. Hooper explains that basic training is not designed to bring an adolescent into independence, but rather to shift the recruit from dependence on his family to dependence on the team. The soldier must learn that he can trust no one but his buddies. Those working with the military need to recognize several common values shared by military personnel, including always maintaining physical fitness, training hard before deployment to reduce casualties, never abandoning fellow warriors in combat, making sure the mission and the unit always come before the individual, and never showing weakness to fellow warriors or to the enemy. If you have served in the Army, those might sound very familiar to you, as a lot of them are the warrior ethos within the Army. One of the major determining factors in most military families is that all-powerful presence, which is often unacknowledged by the family, called the military mission. It's the presence that goes with them everywhere, and without which their lives would have no meaning. From the viewpoint of the military's extended family, style, and demands, the mission takes precedence, and therefore often the service member's relationship with his peers is found to take precedence over the relationship between himself and his spouse, children, or parents. I'm going to out myself just for a minute and say that I like watching military TikTok videos. And there is a Special Forces staff sergeant on there who talked about what it's like coming home and why soldiers might have a very difficult time readjusting right away. And if you guys are familiar with TikTok, I've never made a video, but I think they only last like 60 seconds or something very short. And so he's trying to cover a whole lot of detail in one video. But he talks about why some of his buddies have a really hard time adjusting to the family parties and all that stuff when they come home. And a lot of times it's because they're just not ready for that environment yet. 24 hours ago, they could have been into a firefight in the middle of Afghanistan, and now they're sitting at home around their dining room table eating welcome home cake. And it can be a very drastic change very quickly for them. And their buddies tend to understand what that transition is like. And so if they find themselves needing to spend time with their buddies, even though they just got back together, it's important that maybe we give them that time. And working with the family and letting them know that that's okay, that they're not, leaving us, and they're not, that, it's a normal part of coming home. Looking at social workers in the military, I think it was really interesting kind of looking at this and thinking about how the role of social work has really changed throughout the course of military history. So I'm not going to ask, obviously, because I can only see 4 of you right now, and I'm not going to out who I can see, but the pressure's on now. But not all of us are social workers, but really kind of looking at how the role of social work has changed in the military. So even dating back to 1636, but just briefly, the social work became recognized by the U.S. Armed Forces at the end of World War II as a military occupation specialty. But you can see from the timeline, social work has had some sort of unofficial role since 1636. So social work can be predated to as early as 1636, when the Pilgrims of Plymouth County stated that the care of disabled veterans was enacted. And then more recently, looking at the Civil War with Clara Barton, the founder of the American Red Cross, not only helped wounded soldiers medically, but also assisted soldiers with finding community resources and getting information to and from family members. The Spanish-American War of 1898, when the American Red Cross provided services to members of the armed forces at war. The American Red Cross provided not only medical care to service members, but also non-medical service, carrying a limited means of communication. They handled inquiries from families. The need for psychiatric social workers grew during World War I, when nearly 100,000 service members and veterans were admitted with neuropsychiatric disorders to military hospitals. The first psychiatric social workers had been employed in neurological clinics in 1905 as part of an interdisciplinary clinical team. In 1926, the Veterans Bureau established its own social work department on June 16th. The U.S. Armed Forces started to expand in 1940 and 41. However, the social work specialty was not included in the expansion. This was due to social work not being considered an integral part of the military medical organization. So due to lack of recognition, the Red Cross was tasked with supplying all social workers at the beginning of World War II. But between 42 and 45, about 1,000 American Red Cross psychiatric social workers were assigned to named general and regional hospitals in the U.S. and overseas. It was not until 42 that the military allowed service members to work as psychiatric social workers. So there were 6 enlisted soldiers in the U.S. Army who were professionally qualified as psychiatric social workers, and they were assigned to the newly formed mental hygiene consultation. And that was at Fort Monmouth, New Jersey. In 43, the War Department published the MOS 263 for psychiatric social work technicians. They primarily, during that time, worked under a psychiatrist. The military learned the need of an increase in social services field from errors made in World War I and World War II. During these 2 wars, social workers would be deployed with mental hygiene units to combat zones and continue to work in medical settings. The Red Cross ceased contributions to the psychosocial service due to the increasing need for professionally trained mental health professionals during the Vietnam War. The need was too great for the organization to sustain on its own. So prior to the Red Cross withdrawing, several civilian psychiatric social workers had laid the foundation for an official social work program in the Navy. Eventually, the concern about the large numbers of POWs and personnel listed as MIA or missing in action provided a catalyst for increasing the role of social work in the Navy. In 72, a Center for POW Studies was established. Most social work expanded during the Persian Gulf War until September 11th of 2001. After the Cold War and the Gulf War of 90 to 91, many social work-led programs increased in funding and in size. The Family Advocacy Program expanded greatly during this time period. So did the social work role within the military in general and in veterans hospitals. The Navy was an example of the expansion. According to the U.S. Navy Medical Service Corps, during Operation Desert Shield and Storm, social workers were deployed for the first time to a combat zone on board hospital ships Comfort and Mercy and Fleet Hospital 5. They provided counseling and referral services and mental health support. And the global war on terrorism continued utilizing social workers in combat zones. Military social workers now work in behavioral health units, combat operational stress control detachments, and warrior and transition units, which focus on injured returning troops and their transition into civilian society. So I know it's a lot to say about social workers, and I'll just give counselors a little bit of a shout out. Hey, counselors, at least you can now work for the federal government, which is a win, right? Because it used to just be social work. There's been a lot of changes that are starting to happen. And even within the state of West Virginia, there are, I believe, 6 commissioned social work spots. And there are now also civilian social work and counseling spots available to work directly with the National Guard. At least with the Army. I can't remember how the Air Force did it. I don't know if anybody has that knowledge and wants to type it into the chat box or not. But I know there's a mental health unit in the Air Force, at least civilian, that is out of Martinsburg, I believe. Just kind of looking into some unique clinical challenges. These are consistent with military culture, barriers to seeking help, including concerns about being weak, feelings of embarrassment, and concern about reactions from leadership. For some, another barrier to seeking treatment for PTSD within a Veterans Healthcare Administration or DoD setting is fear that documentation of PTSD-related problems in the medical record might have an adverse effect on advancements in military career or later employment. So through this section, we'll kind of look closely at stigma, the service member experience, and the whole human being. But one thing I kind of recommend is, as we're working with active service members, obviously this should be something we consider with everybody, but being cautious of the diagnoses that we use. So if somebody has a security clearance and we feel based off initial encounter that they have bipolar disorder, we document that, then that could potentially be something that damages their security clearance and impacts their career. So it's always erring on the side of caution with with our diagnoses, the way that we should consider. So while it remains a societal issue, it is much more pronounced in the military, as the perception amongst the ranks is that seeking mental health care means you may be weak or a coward. As many as 16% of the troops questioned admitted to symptoms of severe depression, post-combat stress disorder, and other problems. Of those, 6 out of 10 questioned felt their leaders would treat them differently and that fellow troops would lose confidence in them. As many as 65% said they would be seen as weak. And the results of the study by Colonel Charles Hogue and colleagues was to reduce the stigma of mental health care, to make seeking mental health care as routine as getting an x-ray or a checkup. Within the National Guard, we would have to do medical evaluations at least once a year, and part of that was sitting down with a dentist and sitting down with nutritionists or physician's assistants. And then my last year, I think we started interacting with social workers, and they would check us, do brief assessments for things like PTSD, depression, different things. So soldiers were also encouraged to understand the stress reactions, difficulty sleeping, reliving incidents in your mind, emotional detachment are common and expected after combat. The use of normalization from the mental health provider will assist in decreasing the feelings of being alone or weak. The other thing to kind of think about is with a lot of us who might not be working within the VA system, we will probably work with a lot of National Guardsmen. So being a former National Guardsman, it's important to remember that sometimes we're called up not for combat, but for state active duty missions. So search and rescues, or going to respond even to different states to help with firefights, or to do flood duty. You still witness things during that time that can stay with you. Excuse me. And so making sure that we assess for non-combat related stressors as well. Sorry about that. And so you know, again, even if we don't know, it's always okay to just ask. You know, have you ever been deployed federally or within the state? And that might give us an insight into maybe what some of their struggles are. If they're having physiological reactions around the same time of year, maybe they had a statewide deployment at that point, and a physical symptom that comes is just a trigger for them. Confidentiality remains one of the biggest barriers to reducing stigma. Firm laws are in place protecting patient privacy, and the soldier still has HIPAA rights. There are, however, a few circumstances in which mental health providers are required to inform authorities of safety risks. This will not come as a surprise. These include suspected harm to self or others that the soldier reveals. It is indeed the case that there are limits to confidentiality, and it is those that create the perception that confidentiality is not kept. However, violating confidentiality is a rare exception rather than the norm. In order to protect the privacy of soldiers, most providers will also remind them of these limits if it appears that they might report something that will require disclosure to authorities. There is a push right now through social media platforms in which they're trying to normalize soldiers going to talk to somebody for help. But unfortunately, there's still a stigma about enlisting to begin with. So even if you're on a psychiatric medication, there is a decreased chance of being admitted into the services. And that's without you have to be off of it. I believe the duration is about 2 years before enlisting. So there's still the stigmas around mental health and the service. So looking at the service member experience, just some statistics. This was a study that was completed by the VA National Center for PTSD back in 2010 on recorded war zone experiences by members of the military. Found that 60% reported being attacked or ambushed, 86% received incoming fire, 50% were shot at, 36% discharged their weapon, 63% saw dead bodies, and 79% reported knowing someone seriously wounded or killed. Additional stressors include long working hours, heavy workloads, conflicts with supervisors, and no option to leave the job. Work-family conflicts, which include long separations and fears, sexual harassments and perceived threat, the fear of harm that a service member may experience in the war zone. So it's not just about the enemy at times. Sometimes it's about other things that we witness or the fear of happening. Okay. So here is a short video of a Humvee driving through Baghdad. And one thing I would like you guys to remember, one, if you are a service member who happen to be in this area of operation or just any operation, you by no means are required to watch this video. But it's just kind of a short trip of what soldiers might experience driving through Baghdad in a combat zone. There is a little bit of soldier language, I'll say it that way, just at the end of the video. I believe my volume is down. Mary and I tested this a little bit ago. Just kind of keep an eye, especially if you have headphones in. It could be a little loud at first. Fingers crossed.
Oncoming, maybe? Yeah, there you go. Stay to the left. This guy just picking his.
And then there's another question, social workers know in terms of working with different cohorts of military service people, greatest generation in Vietnam. The biggest, I've not noticed a huge difference in working with different generations. Sometimes it could be what it was like when they came home. My supervisor and I had a lot of discussion about this. And part of that was, when we look at the greatest generation, it was a point system. And then when they came home, it was on ships and they were with guys that they served with. And they had, it wasn't just flown home and then 24 hours you're in a different location. Vietnam, you look at it and it might have been coming home with one or two people that you served with. And then there's no parades, there's no fanfare, there's no nothing. You're not seen as a hero. You're changing your uniform to where no one knows that you just came back from Vietnam. Iraq and Afghanistan, now there are lots of, not necessarily parades, there were at the beginning of the war, but now there's at least ceremonies where the general and command sergeant majors are there welcoming their soldiers home. So sometimes, how folks come home and perceive what they've done can be a little bit different, but at the end of the day, we're dealing with traumas. We're dealing with readjustments. One of the, we'll get into it, I'm trying to look at the clock here, but we'll get into it in a little bit, just kind of how, the survival rates between Iraq and Afghanistan have gone up just with the advancements of body armor and just different protective equipment. The Humvee you saw looked like it was relatively up armored. So, they didn't have those back in Vietnam or really in World War II. So there are just some of those changes as well. Just so I can stick to this, I'm going to skip over and just kind of jump into some substance abuse information and just kind of going about this just a little bit. So substance abuse became a large problem for the military during Vietnam. As service members were returning from Vietnam addicted to opiates, heroin, and or marijuana. There's some public law that was enacted in '71 called Public Law 92-129, which mandated a program for the identification and treatment of drug and alcohol dependent individuals in all branches of the armed forces. Military substance abuse prevention programs parallel civilian EAP. However, unlike civilian programs which aim for economic benefits, military programs are aimed at assuring force readiness. So there was involvements with AA using the 12-step model, but one of the main criterion for the provider is that they're actually in recovery themselves. So it was more of like a peer recovery mindset in a way. Each branch viewed the counselor role differently. Both the Army and Navy used individuals in recovery. But the Army established the counselor role as a specific duty, while the Navy had the counselor as an extra duty. And then there was the growth of other substance abuse programs utilizing the audit. In the mid-1980s, sorry. In the mid-1980s, a zero tolerance policy was implemented, in which any report of illegal drug use, whether by self or by others, could result in administrative discharge and perhaps even criminal prosecution. Treatment by the VA was granted to those individuals who came forward. So some studies, the National Survey on Drug Use and Health found that almost 60% of veterans reported recent alcohol use and 7.4% reported heavy use. These rates are higher than those found in civilians, although rates of substance abuse and dependence diagnoses were like civilian rates. So a more recent study by Wagner in 2010 showed that Army soldiers returning from Iraq deployments indicated 27% had positive responses to an alcohol screening measure. They were likely to engage in risky behaviors like drunk driving and had experienced negative consequences like missing work. Some even would show up for PT smelling like the night before. Some assessments, thinking about initial screenings and self-reports. One thing that I've learned to ask not just service members, but anybody doing a drug and alcohol intake is when they say they have 3 to 4 drinks a night, I tend to ask how big the drinks were. Sometimes we will minimize our use by saying 3 to 4, but in reality, we're having double that. Looking at interview and history, so what is their pre-military, their military, and their post-military. Assessing their strengths and their skills, but also assessment of risks. So in the pre-military is kind of, did they drink a lot then? Did they use then? How did they respond to stress pre-military? During the military, how did they respond when they found out they were getting ready to deploy? Post-military, how are they dealing with readjustment, and how are they dealing with life now? Stigma and barriers to substance use disorder treatment. A 2007 report by the American Psychological Association identified multiple self-reported barriers to care for returning veterans with any mental health concerns. Some of the more common responses included not being able to get time off from work, it being difficult to schedule an appointment, and not trusting mental health providers. The 3 most cited responses involved fears that leaders would blame them, that leaders would treat them differently, or that their units would lose confidence in them. These highlight the powerful and real impact that military culture has on veterans. And the role of alcohol. The DoD has policies to enforce a legal drinking age of 21, and this discourages underage and problem drinking among troops. Recent studies suggest that service personnel have higher rates of heavy and hazardous drinking. The military, including veteran service organizations, has long traditions of providing bars and clubs that serve alcohol as social gathering places for personnel. And because of time, I will not share that story. Okay, so finally, some ethical considerations. So some multicultural competences. Becoming aware of our own behavior, values, biases, preconceived notions, personal limitations. Obviously, we work within our own comfort level, understanding the worldview of our culturally different clients without negative judgment, actively developing and practicing appropriate, relevant, and sensitive strategies, working with our culturally diverse clients. We can see this being played throughout our profession as we speak, without just talking about veterans, just looking at our profession as a whole. Shout out to the School of Social Work for that. And then concerns and dilemmas. So soldiers have always been asked to put aside their own emotional needs for the welfare of their unit and their country. They've been expected to perpetrate acts of violence, bear witness to acts of violence, and live under the specter of their own death at any moment of any day. And this is within the nature of military service and combat. We just recently had Veterans Day, and a lot of times you'll see circulating social media the meme of something to the effect of each veteran service member signed a blank check to the United States of America up to and including their own life. The lengthy duration and unique combat challenges of military operations in Iraq and Afghanistan have resulted in differences such as troop shortages, numerous repeated tours of duty, more reservists seeing active duty, and more traumatic brain injuries and loss of limbs due to improvised explosive devices. A remarkable percentage of wounded soldiers in these wars are surviving their injuries, which is around 90%, which is thanks to advances in infection control, body armor, quick evacuation for medical care. As such, significantly more troops are returning home with complex physical and mental health challenges than in previous wars. Among the returning troops, there's a prevalence of depression, PTSD, subjective poor health, alcohol use, and then even discussions about things like moral injury. These situations present a palpable range of ethical concerns and dilemmas for practitioners who work with the military population. And kind of thinking about military social workers, we fall under the UCMJ, but we also the NASW Code of Ethics. So looking at kind of the balances there. The UCMJ states the needs of the military missions prevail. The underlying principle is drawn from a utilitarian model, which espouses that soldiers have the ethical obligation to sacrifice their individual freedoms for the greater good of society. Military experience and culture are one that emphasizes the group mentality over the individual, the mission over the needs of one, and the values, the mission over the individual introspection. The primary ethical challenge for the military social worker is the underlying tension between the value system of the military versus that of the social work, which relates to our self-determination. So given the breadth, sorry.
Sorry, Phil, there's just a quick question in the
Yep.
chat. I don't know if you have a second to answer it.
Yes.
Someone wanted to know if there's a correlation between the age of the soldier and substance abuse. They said they know that in World War II, the average age of the soldier was older than for instance, than in Vietnam. But is that true with more recent conflicts?
So I've not broken it down, like looked at the statistics and broken it down. I do know that you can pull up on the VA website and break down demographics even further to look at ages, genders, locations, even within parts of the country. But for the purpose of the discussions that I've prepped for this year, I didn't break it down to that point. So yeah, I'm sorry, I don't have a clear exact answer for that one. But that kind of takes us to the end anyway. So are there other questions, thoughts, comments?